Community health began as an idea. Actually, we were focusing on children ready to learn. We were part of a project called the Family Resource Center in Pittsburgh, and it was designed to make sure children had everything they needed to be a success in school, no matter where they came from, or what their economic status was, or what their home life was like, that we would have zero disparities in learning. So part of that is, healthy teeth and a healthy body matters in education. So we started out in a classroom on the second floor of a 90-year-old school building, doing immunizations and physicals, regardless of ability to pay. It was kind of a mission of love. Then we discovered the kids had parents who had needs, so we started taking care of the parents. We got a double-wide trailer donated to us, which we thought was the biggest space in the world. We would never need anything more. And within a few months, people were standing outside lined up to get health care. And we grew from that double-wide trailer to now one of the largest health centers in the Midwest in a rural area.
We provide comprehensive primary care, so that's everything from prenatal care. We provide deliveries here in Pittsburgh. Pediatrics, we have 5 pediatricians on staff throughout the network. We have family practice, we have internal medicine, we have specialty care. So if you only look at our medical services, it's comprehensive from babies to seniors. We provide that care off-site in some settings, like in schools and long-term care facilities. And then dental is its own service line, so we provide dental services in 38 school districts in Southeast Kansas. This year we screened 33,000 children for oral health problems, an all-time high. Behavioral health is a big part of what we do here, and also addiction treatment, which has become, unfortunately, a real focus for us.
And it actually began with a story of a 4-year-old who showed up one day who had not eaten solid food in her entire life because every tooth was rotten. And when you start looking for help for those children, because she was in the gap, she didn't have Medicaid, she didn't have private insurance, we began to recognize that there was a large number of people that just didn't have access to health care. And you read that, you see the data, you understand that, but when it's standing in front of you saying, help me, you can't walk away from that. So yes, it started out with an idea of just helping people and understanding that not everybody had the resources. They didn't have transportation sometimes, or they didn't have the funds, and figuring out a way to bring the whole community together to make it possible that everyone in Southeast Kansas had access to care. The children, their parents, their grandparents, new immigrants, new migrants to our community. We want everyone to be able to walk in a door and be treated equally, and that's what we've done.
I think it's really simple to draw lines around what you do. We think in silos. This is medical, this is dental, this is behavioral health. But if your larger goal is to help people be healthy and heal, you don't draw so many lines about what you do and what you don't do. So we've really focused on being an organization that says yes, instead of saying, we don't really do that. As in my opinion, most places do. We try to say, hey, this is the problem you have, and maybe I can't meet it today, but if I hear that problem 3 or 4 times, we will, as an organization, begin to move in a direction to solve those problems. Most recently, it's using technology for specialty care. So we have relatively affordable technology that allows you to sit in a room and talk to a dermatologist who may be in North Carolina, provide you health care, do it affordably if you're uninsured, and not have to drive an hour or 2 hours or wait 6 months. And that came directly out of one patient experience that stuck with me about somebody who couldn't get cardiology because it was going to cost $500, and could come here if we could make the technology work and get that same care for $75. With the help of Optic now, we have essentially a private broadband network that connects all of our clinics. And when phone calls come in to that communication center, it's a 4-digit extension to call any number of the 300 people that work here. It's essentially a local call. So when those phone calls come in, we can have people who are best trained to answer them and get those calls answered as quickly as possible. And on busy days, we get 2,400 phone calls in a day. If you're true to your purpose, and that's getting people what they need when they need it, then you just don't see barriers and you don't see walls. You just work and you get things done for people.
What excites me is that a small group of people made the impossible possible, and every day it gets bigger and better. and it attracts people who are mission focused. Yes, everybody needs money to survive, and we have to have a margin to do what we do. But our primary purpose is focusing on the patients. We're patient owned, we're patient operated. That's what excites me, is we've created something out of nothing, and it's turned out to be a wonderful addition to Southeast Kansas, and we are changing lives every day.